The people often ask us that I need a chin augmentation, I want a profiloplasty. So what is profiloplasty? Profiloplasty is trying to organize or rearrange the profile of your face. There are certain parameters within which we assess the profile of the face, and there are certain meridians and certain lines and certain measurements that we do to see if your forehead, nose, chin, lips are all in the proportion or the line that they should be in. So most commonly what happens is the nose and the chin, when you're doing a rhinoplasty, usually we see that the chin also needs some kind of a work, which can either be, most commonly is it's retruded and needs to be augmented. Now the chin, again in profiloplasty, we also see whether the chin needs to be augmented, whether it needs to be pushed forward, or whether it needs to be pushed downwards, or whether it needs to be pushed downwards and outwards. So these are all the things that we look for when we're doing a profiloplasty change. Profiloplasty, you can do the rhinoplasty, you can do a chin and the lip corrections, and or lengthening of the lower segment, depending on the various parameters that we measure when we come in for a profiloplasty. When you're doing a profiloplasty or a chin augmentation, what are your options? So again, as with the nose, we have two options, which is either a non-surgical or a surgical. Now non-surgical options are again two. In non-surgical, we can either do fillers or we can use your own fat. So fillers, how do they work? The fillers are injected on the chin depending on where you want it, and it could be in the subcute, or it could be on the bone, or it could be in between, depending on the type of filler that is used, and that can be injected onto the bone to give you a more prominent chin. So this can be done using fillers, and as I said, there are two. Most commonly what we use are the hyaluronic acid fillers, which are temporary fillers, and they will last you anywhere between about a year to year and a half, after which you might have to redo the procedure. The other option is to do in a minimally surgical intervention, is to do a fat grafting. So what we do is, like we do fat grafting for other areas of the face, similarly we can do fat grafting for the chin as well. So fat is harvested from usually your tummy or your thigh, and then that is injected into the chin area, and it basically acts like a filler, and we can replace the volume loss that is happening because of aging, or if you don't have a volume here, we are increasing the volume using a filler. So in the surgical options, you have to put in an implant. So you can either, implant is the most common and the most commonly performed procedure. You can do a bone grafting and bone reshaping or a genioplasty, but genioplasty is usually for reductions, but you can most commonly is an implant. There are two kinds of implants. You can either do a silicone implant, or you can do something called a med pore implant, which is a porous implant. It is a much more stronger implant. For women or for ladies, I usually prefer the silicone implant, which is done by a small incision under the chin, and it's about a half a centimeter to 1 centimeter incision from under the chin. We put in the implant to give you an augmentation. For the men, I prefer the med pore implants, which are more stronger and which are more solid and gives you a more masculine, squarish kind of a look for the chin, but that is done through an incision intraorally. And so these are your two options when you're doing a surgical or chin augmentation. Procedure is usually all daycare procedure, and you can go home the same day. If you're doing an intraoral procedure, then you're on a liquid diet for about a week, and if it's an extraoral procedure, in about 3 to 4 days time, you're back to doing all your routine activities, and it takes about 3 months for the complete healing and for the complete. So these are your options when you're looking for a chin augmentation. So it could be either surgical or minimally surgical, or totally non-surgical. Non-surgical fillers, minimally surgical, that is fat grafting, and surgical is of course implants, which could be either med pore or silicone. So if you have any other doubts, please drop in a line, drop in a message, we'll answer that for you.